as I welcome Julia to make the next presentation. So over to you, Julia.
Hi, Milka. How are you?
Hi.
Can you just confirm you can see my screen?
Yes, please go ahead.
Okay. Great. So hi everyone, my name is Julia Liguori and I am doing a PhD at the French Institute of Research and for Sustainable Development and in partnership with the University of Ghana in Accra. So today I'm going to talk to you about a project that I'm currently working on and on behalf of members of the research team that's called Menus and Meals Served to School Pupils in Ghana's Greater Accra region. So this study aims to assess how nutritious are school meals in the Ghana School Feeding Program and what can be done to improve this according to school caterers who are tasked with food procurement in this region and in the rest of the country. Specific objectives include exploring the nutritional quality of the Ghana School Feeding Program menus by assessing their compliance with nutritional standards and guidelines, and to explore the food procurement aspect through a lens of everyday experiences of the food caterers as key actors and stakeholders in this program. Food procurement is viewed as a potential lever to improve healthy food choices. So we want to look at how healthy food and school meals could improve overall access to healthy food and enhance nutritional status. A little background on school meals in Ghana. The school meals program was officially launched in 2005 as part of the government's effort to create a national social safety net to combat hunger and poverty. And it aims to increase school enrollment, reduce hunger and malnutrition, and boost national food production by serving all primary school children one nutritionally adequate meal per school day. This program has been really widely expanded from about 1,000 children being covered or pupils being covered in 2006 to over 2.5 million students participating based on 2022 estimates. So the government of Ghana, in their policies and implementation of this program, have pledged to follow international guidelines, which set an RDA at 30%. And when you read the documents, the following nutritional quality aspects are included. So it says the meal should be nutritionally adequate, should be fortified with micronutrients, iodized salt should always be used, and it should also follow the set menu set by the government. However, we can see that just saying something is nutritionally adequate is not necessarily clearly defined, which perhaps leaves rooms for some diverse interpretations. So that's one of the things we were interested in. I just also wanted to explain a bit about how food procurement works in this system. So Ghana has a decentralized school meal program, which means that there's no national purchasing or distribution of food goods to the schools. This means that each individual school is responsible for hiring a school food caterer to implement the school meal program. So guidelines come in the form of a weekly school menu, which are created and shared with caterers in each district. The school caterer in Ghana is therefore in charge of a lot of aspects of food procurement, specifically these 5 that have just been highlighted on the screen. This framework is a work in progress in my current PhD to show that all the different steps involved in the school food system, from the production of food all the way to feeding students, and then beyond that to students engagement as student stakeholders and the overall community support and involvement. So in Ghana, the caterers are tasked with 5 steps of procurement, including selecting the food, purchasing food, preparing, which includes cooking, transporting the food to the schools, as often there are no cooking facilities on site, and then serving and clearing up the meal that is eventually served. So this overall key point makes school caterers a key actor in the school food system. So in terms of methods, semi-quantitative interviews were collected with school caterers during the data collection stage of the Meals for NCDs project, which was led by Professor Amos Lahr. I'm sure many of you are familiar with it, as it's one of the foundations founding projects that kind of launched this network. And with the overall goal of measuring and supporting public sector actions to create healthy food environments in Ghana to prevent non-communicable diseases and obesity, especially among children and adolescents. Excuse me. So in this study, 6 districts of the Greater Accra region were purposely selected. 200 schools were randomly selected, but only 129 of them actually participated in the Ghana meal program. So only 129 caterers were interviewed. So all of the caterers in schools that were selected did agree to participate. And these interviews were conducted between March and April 2021. Questions were asked about current school menus, dishes served that week, allocated budget, nutritional guidelines, and food preparation methods. So I just wanted to show you a couple examples of images that were collected from schools during the study. So we actually asked to see the current menus that were served. So these menus were analyzed during the interviews, or sorry, these menus were identified during the interviews and were analyzed to assess the types of food provided in the school meals. So we also looked, so in terms of results, we also looked at the energy density and the nutritional density of these meals that were served. So all the districts included shared a weekly menu, which featured 5 traditional Ghanaian dishes: banku, beans and gari, jollof rice, rice and stew, and wachi. Other dishes such as rice balls, omotuo, kenke, were also commonly featured in the meals served, but not always on the menus that were provided by the districts. So, and as you can see in this table, energy density was varied across all the meals, ranging from low to high, with one meal scoring in the low category and one meal scoring in the high category. Nutritional density also varied, but fortunately was much more positive. And there is one meal, so white rice cooked with tomato stew, that was not deemed nutrient dense. These are estimates for 100 kcal calculations. So for example, wachi is the only dish that had high nutrient and energy density. So we can talk about that more later. While all schools served the same base menu, many variations were reported, which shows that the compliance with menu guidelines is not always followed. For example, in a school where rice and stew was on the menu, the rice is always the same, more or less, when it's white rice served, but there are 14 different variations of the stews or the items that accompanied that rice. So the nutritional variation has many possibilities. And so this was really in terms of continuing that exploration of nutritional quality of the school meals menus to try to assess their compliance if they're really following these planned menus. We also, since the interviews were semi-quantitative, there were a bunch of explanations from participants on why what the caterers' perspectives were about the school meal program. There were quite open questions, and one of the themes that came up a lot was the allocated budget. So the allocated budget was widely discussed. Around a quarter of the caterers reported that the budget was sufficient for preparing a school meal that was nutritious and adequate in quantity. But that means that 3/4 and the majority of respondents disagree and find that the current budget is not enough to provide adequate quantity or nutrition to the students in the meals that they cook every day and every week. At the time of the interviews, caterers received one CD per day per child, and that amount has been slightly modified in the past couple months. I just wanted to give you an illustrative quote from a caterer that said the cost per plate in order to meet the nutritional standard for kids is approximately 2.5 CD, but we're paid 1 CD, which is bad. And then another quote highlighting the point that sometimes we can't always follow the menu. So let me just wrap up because I see I'm running out of time. I just wanted to point out it's been discussed a lot today, which makes me very unhappy that it's still such a wide issue, but very happy in terms of that more focus is being drawn to the issue of food safety. So food safety was not specifically asked about in this study, but it emerged as a central theme, with caterers really reporting that they pay attention to their personal hygiene and the surroundings where the food is prepared. But a lot of barriers such as water not being available, clean water not being available to cook with or wash hands with, were also brought up. So in terms of conclusions for now, this is an ongoing project. The guidelines for the plan menus are not always universally followed in these districts, so it might vary in other districts. To verify this, we've made a formal request to ask access the official menus at that time and currently being served to do a match and mismatch analysis. And we can just see the need that there is need for some more support and some more guidelines on nutritional composition in the school meals. So thank you very much for your time and attention.